When I get out of bed on the 1st of April every year, about 90% of my budget's committed before I even do anything, with some mandatory services like drug and alcohol services, school nurses, health visiting, and a whole range of other things. So for me, it's the constant challenge is the art of the possible. The key thing for any director of public health is to try and keep the population's health improving, but actually make sure that those who are worst off or least healthy catch up. And so you need relationships with communities. I work in a shire county. I couldn't do my job without working with the 10 district and borough councils. I just couldn't. I wouldn't get stuff done. An area as big as Hertfordshire and a topic as big as keeping people healthy as long as possible, you need to build alliances, otherwise you won't get the job done. You can't do public health without working with district councils. They are the real leaders in sport and physical activity, and they are actually crucial to public health. And we thought this project would help us work together with district councils and with the sports partnership and with the voluntary sector and sports clubs. The second thing is we thought we'd get some expertise that we didn't have in public health, and that we would get some people who sat between the sport and the public health world and could interpret one to the other. And we were right, we did get that. And the third thing we thought and hoped we would get would be a new physical activity framework for commissioning, where all the commissioners signed up and all the interested parties signed up. So for us, there were some really strong attractions to the project, and it delivered, and we're really glad we got it. We were very lucky, and it's been great. So this project has helped us actually look at cultural change, look at how planning, environment, transport, sport, health, NHS can all work together. And I think that's a good foundation. Medium term, I think it's given us some focus on some specific areas. So if we take disabled people, in Hertfordshire, about 22% of disabled people take physical activity regularly compared to 38.4% of non-disabled people. That's partly about barriers. So we identified that we needed to do some work. So we've now put in lifts and disabled access in 4 or 5 different swimming pools across the county. We've actually paid for new changing rooms. We invested £500,000 from the public health budget in disabled access to physical activity. So in the medium term, this project has really helped us improve access for disabled people and do something about equity and justice. And I feel really, really proud of that, even though it wasn't me who did it. And I think the short-term stuff is it's helped people look at budgets and spend and fire us up. So if you take all of that together as a package, it's helping us create a culture and an environment where we can really make physical activity second nature for everybody. So if you've got a director of public health who really is evidence obsessed as opposed to evidence driven, which we should all be, then make sure you know the evidence and make sure you understand them and their view. If you've got a director of public health who is much more strategic, then make sure you get inside their head and find out what it is they want to do. Read Exercise or Physical Activity, The Miracle Cure, the piece of work done by the Royal Academy. Fantastic piece of work. That will give you much of the evidence you need, I suspect. Have an open conversation about, these are our objectives as a sport world or physical activity world. What are you trying to achieve as Director of Public Health? And I guess the next thing is try not to kind of say, well, we're here to raid your budget, but actually do be a little bit pushy with the DPH about, well, could you do something slightly differently, and could we lever money into the system, and what can we do together? And I think actually try and understand a long-term as well as short-term. Directors of public health like to think long-term, but we're in a commissioning system that forces us to think short-term. I think we could liberate ourselves from that, and I think the sports world could help us. So those would be my golden rules about building a relationship. And actually, if your DPH is a little bit scary because they're very, very scientific and they're a real boffin, then practice on a DPH who's not quite so much of a boffin. We don't bite usually.